Welcome to the demo of HCP AI Agent. This AI agent is designed to answer real healthcare questions with clinical rigor and auditability. It works directly on patient level claims and presentation data, applies explicit clinical rules, and translates business questions into explainable analytics without assumptions or black boxes. We can ask about provider, patients, treatment, pathway cost, and care continuity. And every answer is grounded in validated clinical logic. The goal is simple: help you generate who is treating whom and how care is delivered and where meaningful opportunity exists, with confidence that outputs can be trusted, reused, and operationalized. To understand how the capability of the HCP agent, let's ask few impactful questions, and we'll start with let's say a single prompt, like which HCP, which is healthcare professional, perform the highest number of surgeries across all centers. Right? The tool, the agent is actually thinking. It will delegate the task. It generated the steps and everything, and in a moment, it will generate the output in a human readable format with analytics followed by visualizations. So here is the tool that basically start giving the answers. Okay. For example, HCP NPI ID 16494, etc. And then what's the name of the HCP professional? And now it is plotting the data. So, as we had initially discussed, healthcare professional name, the surgery count that happened by count, all of this in a simple, easy to understand tabular format. With the visualization, if it helps, for example, David Kaufman has done this number of surgery, which is 12, followed by Dr. Boralin has done the minimum number of surgeries, around 5. Right. Let's ask some more questions to test our agent. Which SCP conducted tumor maker monitoring CA15-3 and for follow-up patients? So here it is clearly laying out the plan. They identify HCPs who had conducted tumor marker monitoring. There are steps that what it is doing: writing a SQL query to normalize data, filing the information, and then followed by again giving the information in a human readable format, visualization. Here it presented the data with the HCP name and the monitoring event. For example, Dr. Lisa Kelly has done the same for 7 times, followed by Dr. Stephen Isakov. Right. It is also asking that it can generate a bar graph for a visual representation of the monitoring. It asks and invoke the tool, which basically does the visual representation. Yeah, again, a simple human readable format and visualization. Right. Let's ask some detailed questions with more information. So, for example, identify patients who completed all phases: surgery, radiations, hormonal therapy, and follow up. So, this is a patient level information so far. We had discussed the doctor level information. Let's just prompt it and see. Again, similar information, claim data, new knowledge based search. So, this all information is embedded in the knowledge search. It in searches in the entire knowledge base, came up with the patient ID and the patient name. Right? So far we have covered doctor level information, patient level information. Let's have some more critical questions. For example, which radiation oncologist administer external beam radiation for stage 2 patients? Let's just understand that how our agent will be able to answer it in a very quick fashion. Again, with the human readable format, and everything is sort of visualized in de facto mode. Here is the data. Again, with respect to the radiation colleges and their NPI ID. Like everything is sort of available in a minute. Now, can we ask another question? And this question is slightly important because it provides high commercial value, basically inform the payer strategy, assess discussions, and contracting priorities. Let's just put it and get the result. Again, it invoked the same knowledge base and started giving the information. Right? So here it provided the payer name, which is say ICICI Health, Maximum Insurance, Aliens, etc. The total treatment cost, right? So basically, it provided all the payers who had handled the highest cost of total treatment for stage 2 HER2 negative breast cancer patients. So this is the level of granularity it can achieve. We'll conclude with the last question. And this question is again more important with respect to the hospital level strategy, which is which SCPs perform lumpectomy, lumpectomy for stage 2 HER2 negative breast cancer patients at Green Valley Cancer Center. Let's just click on it and see how quickly it can get the data. Yeah. So answer has come. So basically, Dr. Julia A. Biller with the NPI ID. So she is the doctor who has performed uh, lumpectomy for stage 2 HER2 negative breast cancer at Green Valley Hospital Centers. Right. So these are the few capabilities that our agent has been able to invoke the knowledge bases, invoke the tool related to normal visualizations and provide it into a pictorial charts and give the information in a single frame. That concludes our demo. Thank you.